Good morning, everyone. Today's topic is ketone bodies metabolism. So, ketone bodies are actually the products of acetyl CoA, which itself is a product of fat oxidation. Now, there is a comment which can be asked in the give the reason question form that fat is burned under the fire of carbohydrate. That says that for the oxidation of fat, carbohydrate is must. Why it is like that? Because we know that at the end of beta oxidation, the product is acetyl CoA. Now, this acetyl CoA enters into the TCA cycle. In TCA cycle, we know that the first step is that acetyl CoA will combine with oxaloacetate and it forms citrate. Then it forms isocitrate and it goes on until there is a regeneration of oxaloacetate. So there is a requirement of oxaloacetate for the oxidation of acetyl CoA. And as we know that acetyl CoA is getting generated from pyruvate. The reaction is pyruvate carboxylase. So this is one of the source of oxaloacetate, and pyruvate itself is a product of glycolysis. Okay, so that's why if glucose get oxidized, then we get the pyruvate, and from pyruvate we can get the oxaloacetate, and then there is a possible oxidation of acetyl CoA through TCA cycle goes on. Okay, so that's why the need of carbohydrate is must for the oxidation of fat. Okay, now in certain conditions such as the starvation or diabetes mellitus, there will be a problem in acetyl CoA oxidation. Okay, we will discuss the individual mechanism why there is a problem in oxidation of acetyl CoA in upcoming slide. So in this kind of condition, what happens? The acetyl CoA starts to accumulate, and this accumulation produces another product which is known as the ketone body. Okay, so presence of ketone body can be seen in the blood and urine in case of starvation and diabetes mellitus. Okay, fine. So the names of ketone bodies are acetoacetate, beta hydroxybutyrate, and acetone. Out of this, acetoacetate is the primary ketone body, while other two are secondary ketone body. The synthesis synthesis of ketone body takes place in the liver. Subcellular site is mitochondria. Okay, so if we see the reaction of ketone body metabolism, in first step there is a condensation of two acetyl CoA molecule. Okay, so two acetyl CoA molecule combines. Enzyme name is synthase. One molecule of CoA SH will be excreted, and the product will be acetoacetyl CoA. Okay, so this is the first step where two molecules of acetyl CoA combines and form acetoacetyl CoA. After that, there is another molecule of acetyl CoA is added to acetoacetyl CoA, and it forms a product which is known as the HMG CoA. Okay, the name of enzyme will be HMG CoA synthase. The full form of this HMB is beta hydroxy beta methyl gluteryl coenzyme A. Okay. After that, there will be breakdown of this HMG-CoA by the enzyme HMG-CoA lyase. The product will be acetoacetate, which is our primary ketone body. Okay, you can see here. Okay, this is a keto group, and the product name is acetoacetate. Okay, now this acetoacetate can undergo the process of dehydrogenation. NADH2 gets oxidized and acetoacetate will be reduced to beta hydroxybutyrate. Okay, beta hydroxybutyrate. In other case, there can be non-enzymatic spontaneous decarboxylation. A CO2 will be released, and from acetoacetate we can get acetone. Okay, so acetoacetate is our primary ketone body, and its product acetone and beta hydroxybutyrate are our secondary ketone bodies. Okay, so this pathway you have to remember. Okay, it's a simple pathway in comparison to the other pathways of the fat metabolism. Okay, and you are already well versed with this particular name HMG-CoA in competitive inhibition of enzyme. Okay, fine. So this pathway you have to remember. Also the names of the ketone body that will be helpful in abnormal urine practical or pathological urine practical. Okay, so that was about the ketone body synthesis. Now coming to the ketolysis. So ketone bodies, they are produced in the liver, but liver cannot utilize ketone bodies. These ketone bodies are utilized by the extrahepatic tissue, mainly heart and kidney. Okay, they prefer ketone bodies as a fuel in compared to glucose. Similarly, brain also can utilize the ketone body as an alternate sources of energy when glucose is not available. Okay, when glucose is not available. Okay, so in this case, the acetoacetate, which is our primary ketone body, it combines with the succinyl CoA in the presence of enzyme thiopharase, and it produces acetoacetyl CoA and succinate. Okay, so this thiopharase enzyme is absent in liver and in RBC. So that's why though liver is producing ketone bodies, but it cannot utilize ketone body as a source of energy. Okay, so this is also one of the question which can be asked in the Viva or even in the 2 marks short answer question. Why liver cannot utilize the ketone bodies? Okay, now the acetoacetyl CoA on that there will be impact of enzyme lyase, so we can get the acetyl CoA which undergoes beta oxidation, and there can be generation of ATP. Okay, so that's why by this pathway some of the organs utilizes ketone body as a source of energy. Okay, so this is the process of ketolysis. Now coming to the disease which is associated with the ketone body metabolism, that is known as the ketosis. Okay, so normally what happens, the rate of synthesis of ketone body is very minimal, and in normal scenario it will be utilized by the tissues other than the liver. Normal level of ketone body in the blood should be less than 1 milligram per deciliter, and they will be absent in a physiological or normal urine sample. But in certain conditions, the rate of synthesis exceeds the ability of the extrahepatic tissue to utilize. Okay, so production by liver of ketone body will be more, but the utilization by the other tissues such as the heart and the kidney will be less. At that time, what will happen? at that time there will be accumulation of ketone bodies in the blood. Okay, now you have to now remember the three scenarios. If ketone body starts accumulating in the blood, then that condition is known as the ketonemia. Then once it level keeps on increasing in the blood, then it starts to excrete in the urine. That condition is known as the ketonuria. And also there will be loss of acetone into the breath. It gives a acetone like smell in the breathing of the patient of ketosis. Okay, so combinedly this triad is known as the ketosis. That is the ketonemia, ketosis or ketonuria, and acetone like breath. This combinedly is known as the ketosis. Okay, so these three name you have to remember if somebody asks you what is a ketosis. Okay, so this is the normal cycle of ketone body. So free fatty acids on oxidation they will produce the acetyl CoA. Extra acetyl CoA will produce ketone bodies. Usually ketone bodies are utilized by the extrahepatic tissue, particularly heart, kidney. Okay, but when the ketone body amount is more in compared to its outcome, then it can be excreted in the urine, which is known as the ketonuria. Initial stage there will be ketonemia, and acetone, which is a one type of metabolic product of ketone body, that is acetone, which is a product of acetoacetate, that will can be excreted in the lungs. That gives the breath acidic breath or smell in the patient of ketosis. Now coming to the causes of ketosis. So when this imbalance takes place, so primary it can take place in the diabetes mellitus. So what is the mechanism here? So this mechanism is extremely important that you have to understand. In diabetes patient, there will be deficiency of insulin. So insulin deficiency causes accelerated lipolysis. So more lipid will come into the circulation. As it comes into the circulation, there will be a process of oxidation of this fatty acid, which increases the acetyl CoA. Okay, so this is the prime mechanism that lipolysis will produce the extra acetyl CoA, which all of them cannot be utilized by the extrahepatic tissue because the limited availability of thiophorase enzyme. Okay, so oxidation of acetyl CoA by TCA cycle will be reduced because we have a very less quantity of oxaloacetate or limited quantity of oxaloacetate which is coming from the carbohydrates. Okay, so extra acetyl CoA goes for the ketone body formation. Another scenario is the starvation. Now here the dietary supply of glucose is decreased. So whatever available availability of oxaloacetate is there, it will channel towards the gluconeogenesis. Okay, so oxaloacetate will be converted to phosphoenol pyruvate and then to pyruvate because our certain organs like brain and RBC they exclusively are depending on the glucose for the energy purpose. Also, there will be increase in the rate of lipolysis because of low carbohydrate. So the stored lipid will start to hydrolyze. There will be process of lipolysis. There will be generation of extra acetyl CoA. Okay. So this process will be favored by glucagon. Okay, and will be inhibited by insulin. Okay. So in starvation also because of the lipolysis, and lipolysis is taking place for the compensation of energy because we have low amount of carbohydrate in the diet. Okay, that will lead to create imbalance of TG production or acetyl-CoA production and its outcome. Okay, so that will lead to ketone body formation. Okay, similar scenario also can be seen in vomiting, hyperemesis. Okay, in early pregnancy, which produces a situation which is similar to starvation, and it may lead to ketosis. Okay, so the explanation of ketogenesis, it takes place in the starvation and diabetes mellitus. Okay, also there will be impact of the hormone. As we know that glucagon will favor the pathways which produces the glucose. It will inhibit the pathways which utilizes glucose. So in this case, it will inhibit the glycolysis, it will activate the gluconeogenesis, it will activate lipolysis and stimulate the ketogenesis. Okay, so this is the scenario in which there can be impact on the ketone body production. Insulin will have a opposite effect along with it. So ketone body formation is regulated at the three step, one at the stage of lipolysis. So if there is a more mobilization of the stored fatty acid from adipose tissue, the other tissue, that is the liver, then there can be production of more ketone bodies. Okay, and as we know that in diabetes, insulin impact will be low, so the inhibition of lipolysis will be affected. Okay, and that will lead to more lipolysis in diabetes mellitus. So that can lead to production of more ketone bodies. Similarly, at the level of entry into the mitochondria. So we discussed that scenario in fatty acid oxidation metabolism, that malonyl CoA is the regulator. Diabetes and starvation, since glucagon is increased, it will reduce the inhibition caused by malonyl CoA. So it will further on stimulate the entry of fatty acid into mitochondria, more oxidation and more acetyl CoA production. And third scenario, at the oxidation of acetyl CoA, where we already discussed the scenario under the cases of starvation and in case of diabetes mellitus. Okay, so you have to remember the both the mechanism why starvation and diabetic ketoacidosis or diabetes mellitus leads to ketone body excretion or excretion in urine, or why there is a extra production of ketone bodies in these two diseases. Okay, so this chart says the same thing what we discussed in the our previous slides. What are the features of ketosis? So it's a type of metabolic acidosis. So there will be reduction in the blood pH. It will become acidic because the presence of acetoacetate and beta hydroxybutyrate. Also, to compensate the acidic picture, the bicarbonate will be utilized. So plasma bicarbonate will be low in metabolic acidosis. As a compensatory part, okay, body will start to excrete more PCO2, and more PCO2 excretion will cause increase in the respiratory rate. That condition is known as the hyperventilation. So all these three correlation you will learn also in acid base metabolism in detail. Okay, there will be smell of acetone, which is acetone is a volatile thing and it will can be excreted into the patient's breath. There will be osmotic diuresis because the impact of ketonuria. Also there will be loss of water. The ketone bodies will be excreted along with the sodium. It will form a bridges with the sodium and it can be excreted in the form of sodium salt. So there will be, or there can be, a condition like dehydration occurs because along with the sodium there will be loss of water. And further on, if this situation continues, then it may lead to coma. So diagnosis of ketosis can be done by the Rotheras test, which you have already learned in the pathological urine examination. Okay. Also, confirmatory or supportive evidence can be done by measuring the electrolyte levels, measuring the acid-base parameters such as the pH, bicarbonate, and PCO2. Also, glucose and urea will be helpful in adjacent diagnosis of ketosis. So, differential diagnosis of ketosis. Now, there are mainly two scenarios where ketosis takes place. One is the starvation, another is diabetes mellitus. So, in diabetes mellitus, the blood sugar will be high, and in starvation, the blood sugar will be low. Okay, so one can measure the blood sugar level or perform Benedict's test to differentiate the cause between starvation and diabetic ketoacidosis for the to find out which is causing the ketone body excretion in urine. Coming to the management part, so mainly here there will be either insulin become insensitive or there is a destruction of beta cells of pancreas. So there is a low uh, availability of insulin. So in treatment, insulin has to be given along with the glucose for the energy purpose. Now, there is one side effect of this that both of them, particularly insulin, traps the potassium inside the cell. So there can be hypokalemia, that is the low calcium in the serum, as a side effect when insulin is given. So that's why the monitoring of electrolyte is very crucial in management. Also, one has to administrate the bicarbonate because of acidosis picture. The buffer has to be supplied and buffer in the form of bicarbonate has to be given. Okay, so that is the main two things one has to give in the management of diabetic ketoacidosis. Okay, so this is the chart which is showing the summary or what are all the chapters what we have discussed in lipid metabolism. So first we discussed about the digestion and absorption, then we discussed the beta oxidation, then fatty acid synthesis, then we discussed triacylglycerol metabolism. In that, we discussed the adipose tissue metabolism. We discussed the disease associated with the fat metabolism, that is a fatty liver. And finally, another important topic, the ketone body metabolism, which we have discussed today. Okay, so these two disorders associated with the fat metabolism are the most important, fatty liver, and second will be the ketone body metabolism. You can check the papers of the last few years. These two topics are repeatedly asked in the examination. Okay, so read well about the ketone body metabolism, okay, and try to understand at earliest. Okay, so that's all about the today's class. Thank you very much.